Yo, what's up guys? It's Truth back in here with another video. Just wanted to make a continuation video off the last video. If you don't know what the last video was, it was based on essential oils. Now, does essential oils work? Is it worth it? Check out the last video to find out my thoughts and what other studies have said about essential oils. Now we're gonna go on the topic of alternative and complementary medicine. Is alternative and complementary medicine worth it? Does it work? Is it better than traditional medicine? Let's find out. Now, just as a quick disclaimer, I found about 6 articles that I want to go talk about. Some are good, some are bad. Let's see what it's all about. So this is the first article. It's just a quick article on what is alternative medicine for people that don't know what alternative medicine is. So it states, alternative medicine is a term that describes medical treatments that are used instead of traditional mainstream therapies. You all know the mainstream therapies out there, CBT, RABT, stuff like that. Some people also refer it to as integrative or complementary medicine. Never heard anyone say integrative, but I've heard people say complementary. This is interesting. More than half of adults in the United States say they use some form of alternative medicine. But exactly what types of therapies are considered alternative? The definition changes as doctors test and move more of them into the mainstream. This article examines some popular alternative medical treatments and their potential risks and benefits. So let's read these alternative medicines that they have here. So they have acupuncture, which we've heard before. Let's see, studies show that acupuncture can be effective in treating health conditions such as neck and back pain, nausea, anxiety, depression, insomnia, infertility, and more. We'll see if that's true later on. We have chiropractic medicine. So this basically helps headaches, neck pain, joint problems, and disorders caused by whiplash. There's energy therapies, such as magnetic field therapy. So studies show that it may work for osteoarthritis and other pain conditions. Some studies have even shown that it may help fractures heal faster. So let's go to the next page. So you have Reiki. So it's basically an alternative treatment that taps into the body's natural energy to speed healing. The practitioner hovers his hands over your body or places them lightly on your skin. The goal is to channel energy through his hands or to your body to promote healing. There's very little research to prove it works. If you were someone that just heard about this and just heard that, if someone hovers their hands over your body or places them lightly on your skin, would you believe that worked? Would you believe that that'll help you heal faster? It sounds more of like a psychological thing right there. Like those placebo tests that they have, where you'll have a test and one will be an actual pill and one will be a sugar pill. And people think that, people that took the sugar pill believed that it was an actual pill, so they thought that they would get better. And a study showed that one did something and one didn't, but they both got the same results, and both of the results were positive. It sounds like this is what's happening here. The person may believe that this is going to help and heal them, so that's essentially what happens. It's basically like the person didn't necessarily do anything. That's probably why there's very little research to prove that it works. But let's keep going. Therapeutic healing touch. Here, a therapist uses his healing energy to identify and repair imbalances in a person's energy field. Unlike Reiki, the therapist doesn't touch you. He simply moves his hands back and forth over your body. Research shows healing touch can reduce anxiety in people who have cancers. It can also increase their sense of well-being, but it's unclear if it works for other issues as well. Sounds like the same exact thing as Reiki, except that the therapist doesn't touch you. So, I don't know, that just sounds really off. How would that work? Like, does like the therapist have magical powers or something? Like, I'll have to go look into that and see what that's all about. Cause if someone, just picture like you're just laying down and like you're going through, let's say, depression or something, and then you have like a practitioner that uses therapeutic touch, and they're just having their hands like over your body but not touching you, and they're saying that they're healing you. Like, just hearing that, like, what that makes sense to you, like, I like that. Just how would that work? It'll have to be like you truly believe that this is gonna make you feel better, so that you feel better psychologically when in reality nothing happened to you. All right, we have herbal medicine. As I told you, part of that is essential oils and aromatherapy, stuff like that. It says 80% of people around the world use herbal medicine. Studies show certain herbs are effective in treating a number of health issues like allergies, premenstrual syndrome, chronic fatigue, and more. Unfortunately, herbal supplements can be sold without being proven to be safe or effective. Talk to your doctor if you're thinking about using them. So this is essentially what I touched on in the last video about the essential oils. Like, it doesn't necessarily have to be proven to be safe or effective, even though most studies show that it's like the results were either had no effect or it was a negative effect. Like, there wasn't that many studies that proved that it was really effective, only on like minor things like the ones that they mentioned over here. But like, if it's like a serious mental health condition, it's not going to do that much unless paired with another therapy method or medication. And then the last one, Ayurvedic medicine. Let's see, it's one of the oldest medical systems. It started in India. Those who use it rely on herbs, special diets, and unique practices to treat illnesses. But Ayurvedic products can also be dangerous. Researchers have found toxic minerals or metals like lead in some of the products. There hasn't been enough research or clinical trials to support that Ayurveda works. Sounds like this is very well. It's old, so I've never heard anyone really use this anymore. So I can't say that it's effective or not effective, but it says that it's dangerous and there hasn't been enough research. So it would be something that you probably wouldn't use at all. So let's go to the next article. So here's the second article, alternatives to prescription drugs. So the question was, are alternative therapies or herbal remedies safe to use as a substitute for traditional medications my doctor might prescribe? Because some herbal remedies and alternative therapies may provide relief to patients with certain conditions. These options can have a role when used in conjunction with traditional Western medicine. So it's saying more of as a complementary therapy instead of an alternative therapy. However, the use of herbal remedies or treatments exclusively does raise concern among many physicians because they are not regulated by the FDA, like prescription and over-the-counter medications are. So essentially, prescriptions and over-the-counter medications have been studied and tested way more than the herbal remedies or alternative therapy methods, because the FDA even regulated these things, but they haven't regulated or looked into that much of herbal remedies and alternative therapies. I mean, look at the studies across the board. They say that there's just not many well-conducted studies that prove any of these things to be truly 100% effective. Okay. The concentration of active ingredients and the presence of inactive ingredients in many of these alternative or natural remedies may be unknown, which can cause dangerous interactions in patients taking other medications or undergoing physician-supervised treatments. Some herbal therapies can also negatively impact the function of key organs like the liver. If a patient is experiencing a minor illness such as a cold, herbal remedies may offer some relief as long as the virus is not worsening. People who are battling more significant diseases, however, should follow the physician's medication recommendations closely and avoid any alternative treatments unless specifically suggested by their doctor. So essentially, this is also what the last video was describing as well, with the articles that were in that one. So essentially, it's saying that alternative therapies and herbal remedies are best used when trying to heal something that's very minor. But if it's like a serious like mental health condition, it's best not to use these things, because again, there hasn't been many things that prove its effectiveness, and the studies aren't as strong as regular medication or over-the-counter medication is. So that's that article. Here's the next one. So this is an article specifically based on cancer, and that people believe that alternative therapies can help like cure cancer. As you can see right here, it says almost 40% believe that cancer can be cured. So, but this article basically is saying that alternative and complementary therapy won't help cancer at all, and may be more dangerous to people like that, because they will go use these alternative and complementary therapies and not use the traditional therapies that help, like chemotherapy and stuff like that. So they essentially don't use those things and only go towards the alternative therapies. And once they do that, they hold back the actual treatment that was suggested for them. So that makes it even worse, because the alternative and complementary therapies don't work as well as the traditional medicine is. So like, let's say you use like herbal remedies for your cancer, like the standard procedures like the chemotherapy and the surgeries are gonna be far better than the like herbal remedies. The herbal remedies may have a chance that it will work, but it's gonna take a lot longer than the actual like treatments would to help. So that's essentially what this whole article is about. I'll leave the article in the description so you can read it on your own, but that's just a summary of what this article is saying. So here's the next article. This one's really interesting. So there's this guy, let's see, where's his name? Edzard Ernst, and he made a book called Scam, and Scam is basically known as so-called alternative medicine. So the reason he calls it a scam is essentially he doesn't believe that alternative medicine works for people, that there's a bunch of people that just basically saying that, oh, you know, all these alternative medicines work, but there's not like anything to necessarily prove it. So some of the things he said was, if a therapy does not work, it cannot be an alternative to medicine. If a therapy does work, it does not belong to alternative medicine, but to medicine. So he's saying if there's a therapy method out there that works, it's essentially called medicine. And if it doesn't work, it can't be an alternative. So essentially, there's no such thing as alternative medicine. So, and in his book that he made, this was a different kind of book, but it was basically about complementary and alternative medicine. And it states that he examined 700 treatment and condition pairs and concluded that only 7.4% was supported by good evidence. That's essentially based like what we have looked at since the last video on the studies on alternative medicine, especially regarding essential oils. So they're basically saying that there's just not enough evidence out there to support this claim that complementary and alternative medicine necessarily work. It's only 7.4%. That's really low. It's not even half. It's way far less than half. So here's what Ernst claims that he looks for when he looks for like in regards of like health and like different treatments that classify as like medicine and just essentially things that help people. So he says evidence is a prerequisite for progress in healthcare. That is true. Something has to have like strong evidence to be considered helpful for other people. You can't just say that, oh, this helps, and essentially people believe it, and then you give people wrong information, and then they end up even worse than what they were. Evidence must be established by rigorous research. So far, you can't really say that for complementary and alternative medicine because there hasn't been much research, and the research hasn't been the best kind of research. So we should not tolerate double standards in healthcare. Patients deserve to be treated with the best available treatments. That is true. They should be treated with the best available treatments out there, even though that the treatments may not be as good as we would like them to be, but they may be the best thing available. And making therapeutic claims that are not supported by sound evidence is wrong. He's basically talking about those alternative therapy and medicine people that's saying that alternative medicine and therapy really works and that there's so much evidence to prove it. It can help this, like it can help anxiety, it can help depression, it can help focusing, it can help headaches, etc., etc. But then when you ask for evidence about it, there's not really anyone that comes up and gives like sound evidence of anything. You'll always find there's something missing in the study, or that the study wasn't done the best of its ability. Like there's many flaws to the study. So this is the last point of this article that I wanted to talk about. So it's titled Why Scam Research is Rarely Negative. Some scam journals and scam researchers never publish negative findings. This isn't evidence for scam's effect, but rather it's its consequence of a trial design that cannot be negative. That's also true. Like whenever you hear people talk about alternative medicine or therapies, they never really talk about the negative results that were found in studies. They only seem to highlight the positives. Like there's no negatives involved, that there's no like risk at all. They just talk about how positive it is, and that doesn't really help because it'll make you believe that it's too good to be true. And essentially that's what people are calling this. It's too good to be true, that it doesn't necessarily help people like others say it is. Ernst calls this the A versus A plus B design, and he describes it in a blog post, studying a trial that purported to show benefit from acupuncture on cancer-related fatigue. Patients received usual care plus acupuncture. The acupuncture group did better. So essentially he's saying that there was two groups. There was one that got the usual care for cancer-related fatigue, and the other group got the usual care plus acupuncture. And they're saying that the acupuncture group did better. And that essentially makes sense. Like, if you went to therapy for depression, right? You had depression, and their therapist says, here's your treatment plan. Let me give you journaling and meditation. Let's say that was the first time you went. So you have journaling and meditation. So let's say you go a second time, and this time you get journaling, medication, and and some medication along with that. So you have 3 things versus the 2 things. So with the 3 things, you're gonna have better results unless if it's like a negative thing. So let's say if like you paired like smoking or drinking with that would be a negative, so you would feel worse. But like the medication is seen as positive. So with that positive, you're going to have a better chance of feeling better. So that's essentially what this is saying as a complementary therapy method. So if you have the regular care and you add something onto it, it makes that effect that the extra thing added onto it did more, when essentially it didn't. It just had a bunch of things added on together, and it produced a result. And it never says that the usual care wasn't as good. It never said the usual care was negative. It's just saying that if you have more than one thing to help you out, of course you're gonna get better results faster. So that's essentially what it's saying. So as a complementary therapy, of course it's gonna help you. It's gonna help you more because you have more things to use under your belt. But if you use it by yourself, then it's not gonna be as effective as the study showed. So this article is on Psychology Today. And I'm going to just give a summary of this article. It's just basically talking about the same things that were introduced before, talking about if alternative therapies work, and they talk about the studies that were conducted and say that there's not enough strong studies to support it, and the strong studies that have been introduced has flaws in the studies, and that the flaws would have to be fixed in order to say it's legitimate, to say that it really works. And they're saying that if people want to use alternatives, they should talk to a professional about it to see if that is right for them. And it just says, I'm going to just read this part here. Traditional treatments aren't inherently superior to alternative ones. They're just better studied, which doesn't mean that they're effective or safe beyond any doubt, just that they're more likely to be. So alternative therapies could be way better than traditional treatments, but it's just saying that it's not studied enough, and there's not enough studies to prove that it works more. So you may have people that believe alternative therapies work, and it may work well for the people that they're helping, but there's just not enough studies, so more people would rely on medication and traditional treatment because there's more studies and more things to back up its usage, and more people essentially use these things more, so it's going to have a better effect on them. The summary of this last article is basically saying that people that find negative results typically hide the treatment, typically hide the studies that happen. So they only want to highlight the positive ones and hide the negative ones, which doesn't help its case at all. Every kind of treatment, there's going to be no treatment that's 100% effective. There's always going to be something wrong with it. There's always going to be some side effects along with it. There's always going to be people that just don't feel better from this treatment. Everyone's different. Everyone has a different way of operating and things, and they take things differently. So they're just saying that negative findings, the non-reporting of negative findings, can lead to redundant research, which will inevitably slow down the validation process. And it could lead to a skew of reports of an already available treatments towards the positive, sending a message to the public that it's effective and useful, whereas there may be in fact a stack of unpublished work detailing the exact opposite. This is essentially what you hear. You hear all these good things about it, but no one ever talks about the negatives about it, the possible things that can happen, the things that go wrong, the side effects and whatnot. All you hear is the positives about it, and it just makes you feel like it's something that's too good to be true. It's just essentially too good to be true, that it doesn't really work. So it leaves people kind of skeptical. They're like, is this actually something that will work, or should I just not even go into it because it just seems kind of fishy? That's what it seems. There's just nothing there's just no negative results that you hear from these certain things. It's just all positive, and everything works. All these things, this can help all of these things, but you never hear things about I had a bad experience with it. There's nothing with sharing that it had a bad experience about it. That's just you being honest and genuine, with the product or whatnot. I would rather have a product or like a therapy or a treatment method that would be honest. Like it says, like it may not work for everyone, it may not work for you, but here's the things that it has done for other people, and here's the things that it hasn't done for people. Like these things have gotten worse. So it's just like, so you can make that decision. But if you hear all these positive things, you're gonna get more people gravitating towards it, and then they have a worse experience. Like they have a terrible experience with it. Like, this didn't help me at all. So it just creates that whole placebo effect. So that is it. That is the end of this video about the truth of alternative medicine and does it work. So most of the articles say that there isn't enough evidence to necessarily prove it. It could be effective and it could work. It's just there's not enough to really prove that it works. Not enough things to back it up. And that most people hide the negative results and the negative findings, so it leads to skewed results and more people believing that it does a lot for them, when in reality it may not. So let me know what you think about alternative therapies and complementary therapies, and I'll see you later. Make sure to hit the subscribe button and click a like on this video. See you later.